Conservative management of lymphedema, the state of the art. The complex or complete decongestive therapy, that is the CDT, is the gold standard of conservative management of lymphedema. It includes skin care, manual lymphatic drainage, compression therapy, which comprises of multi-layered lymphedema bandaging, intermittent pneumatic compression, compression sleeve. CDT also includes exercises, psychological care. There are adjunct or complementary therapies like low-level laser therapy, kinesiologic taping, cupping, extracorporeal shockwave therapy, aquatherapy, yoga, Pilates, Tai Chi, Qigong. Complex or complete decongestive therapy has phases. Initial intensive phase, which lasts for 2 to 4 weeks. There is meticulous skin care, then manual MLD, manual lymphatic drainage for 30 to 60 minutes, followed by multi-layered short stretch bandaging and with foam, and it is done by a certified lymphedema therapist. Exercise to assist lymph movement and graded compression stocking to maintain reduced limb volume. And there is a maintenance phase, which is covered by self-lymphatic drainage, may be given along with exercise and compression sleeve. High failure rates are due to non-compliance. Skin care, which includes that the skin fold should be clean and dry, skin inspection for injury and infection, avoid excessive or prolonged constriction of the affected area, avoid exposure to extreme heat or cold. Now, there are controversies regarding IV pricks, measuring BP, use of razors, exposure to heat and cold. But recently in 2022, it's published that intravenous access and BP monitoring in patients with previous axillary node dissection is not a contraindication. Manual lymphatic drainage, known as MLD, it is a very gentle skin stretching technique designed to move the skin in specific direction to stimulate the lymphatic vessels and move fluid in an area where it can flow more freely. There are various contraindications to MLD, like any infection, renal failure, hypertension, severe cardiac insufficiency, ascites, etc. There are various references. Most of the studies show that MLD helps to reduce pain, soften the tissues, but there is poor result in reducing volume. Hence, it needs to be followed by multi-layered bandaging. There is a position document for understanding the compression therapy. Compression therapy consists of multi-layered bandaging, sleeve or stockings, also the wraps, and mechanical compression system. This works on the principle of Laplace law, where the sub bandage pressure is directly proportional to tension applied and number of turns, and inversely proportional to the circumference and width of the bandage. This is multi-layered bandaging. You can see finger bandages, stockinette, foam, and short stretch bandage. There are two types of bandages on the right side. You can see those short stretch bandages for curative stage and elastomer bandages used in palliative patients. We should be checking out for the range of motion, circulation, sensation, and level of comfort after bandaging is done. Hybrid bandages, also known as fast and go bandages, they are recently in market, but it lacks evidence. Hence, we have submitted a crossover study. The principal investigator is our head of physiotherapy department, Dr. Anuradha Daptardar. The study is to evaluate the acceptance and experience of hybrid bandages by the patients with lymphedema, effectiveness of hybrid bandages in limb volume reduction, and also to assess the quality of life. Compression garment depends on physical properties and construction of the compression garment. The tension depends upon the type of yarn used. And there are, you can see there is one inlay yarn and body yarn. The body yarn delivers the thickness and stiffness, and inlay yarn produces the compression. There are two types of materials, that is a circular knit and flat knit. Circular knit, usually ready-made garments, and they're used for early stages of lymphedema, whereas flat knit garments are used, they're more stiff and they can adapt to shape distortion easily, and hence they're used for later stages of lymphedema. Pressure prescriptions. Garments are prescribed as per the condition and the stage of lymphedema, and there are class 1 to 4 garments which differs for different countries. So accordingly, we can prescribe the garment. Compression garments, there are ready-made, custom-made, and Velcro wraps. These are ferro wraps and circuit wraps, and which can be easier to be worn as compared to the regular compression garment. So old people who cannot don the regular garment can use these. Intermittent pneumatic compression pump, they are multi-chambered ones. Usually 12 chamber is used in our department. IPC is not a standalone treatment. It has to be combined with bandaging, and it has various modes like the pre-therapy, limb or sequential, wave, and limb assist modes. Exercise or physical activity. It increases the uptake by initial lymphatics. It increases the pumping of the lymphatics due to the smooth muscle contraction, emptying of the venous system, and reducing the overload of failing lymphatics. Obesity further impairs the lymphatic function. Hence, aerobic and resistance exercises and daily physical activity is very important. To lift weight or not. Initially, it was thought that lifting weight on affected side is harmful, but there are many studies proving that weight training appears to be safe and beneficial in improving the limb strength and physical components of quality of life in women with or at risk of lymphedema. Especially low volume resistance training might be a suitable exercise. Exercise recommendation. Exercise prescription is given by using the FIT principle. Heart rate max and rate of perceived exertion is usually considered as parameters in cancer patients. 3 to 5 times a week, both aerobic and resistance exercises are planned, and small bouts of exercises can be considered in cancer patients. There are various midline structures like facial lymphedema, which can be managed by manual lymphatic drainage, compression garments, exercises. And there are bandages for scrotal edema treated by foam and Coban bandages in 2 layers, and even for penis, the bandages with foam and Coban is used. There are other optional treatment modalities that are gaining importance nowadays. And one of them is low-level laser therapy, effective in reducing limb circumference and volume. Then there is kinesiology taping, also found to be a complementary therapy for reducing lymphedema, but cannot substitute multi-layer compression therapy. Aquatherapy could be considered as an adjunct treatment for lymphedema, positive impact in reducing pain, improving range of motion, improving cardiopulmonary fitness, quality of life, but inconclusive about its effect on lymphedema. It also has limitations. Smaller studies are done, lack of standardized exercise parameters, limited long-term follow-ups. So there are many studies on other therapies like Pilates, Yogasana, Tai Chi. You can see these. There are many studies that I have quoted, Tai Chi and Qigong, which has a positive effect on reducing pain, increasing range of motion, strength, functional status, quality of life, etc. But these are complementary therapies and cannot replace the gold standard complete decongestive therapy. They can only be adjunct to the complete decongestive therapy. Thank you.